Good afternoon, everyone. I'm Brooke Benscooter with the Association of Food and Drug Officials, and we'd like to welcome you and thank you for joining us for today's webinar as part of the AFDO Professional Development Series. Today, our topic is Cannabis 101, and who better to help us with that than Leslie Engelking. I've had the honor of talking with Leslie and doing a couple of podcasts. And one of the things I know is that she's awesome at distilling information and making it easy to understand and take in. So I'm looking forward to today's Cannabis 101 session. Leslie is the founder of Focus, which is a nonprofit that was created to address some of the shortcomings that have been in the cannabis industry and its system. And she's going to talk more and share more about her background as part of her presentation. And then the other thing that I think is awesome is she's co-chair of the AFDO Cannabis Committee. So with that, Leslie, I'm going to turn it over to you, and we're all ready to go.
Perfect. Thank you so much, Brooke, and a big thanks to AFDO for asking me to do this, and thank you all for joining us. I don't know if you were registered for the first one or not. This was originally scheduled to take place on 4/20, and unfortunately I came down with a stomach bug and had to reschedule. So we're doing that today, and I appreciate you joining us again. Well, let's see here. So I'm Leslie. I'm the founder of Focus. I'll tell you a little bit about Focus, and I'll tell you a little bit about myself. So as Brooke said, we are a 501c3 nonprofit. We are designed as the health and safety organization, and our mission is to protect public health, consumer safety, and the environment in the cannabis industry. One of the unique things about Focus is that we are truly a third party. We have no financial stake in or funding from the cannabis industry. We don't advocate or push for cannabis regulations to move forward. Our position is simply that if there's going to be cannabis programs, there needs to be adequate protections for health and safety. So when we started the company in 2014, we worked with ANSI to develop voluntary consensus standards that would be, acceptable for use in regulations. And we are currently in the process of finishing up our ISO international accreditation as a cannabis-specific certifying body. So we're hoping to get that done this month, actually. But I also wanted to tell you a little bit about how I got here. Well, maybe. Because it's not a normal path, and people always ask me, and I think it's interesting because I don't come from the cannabis industry. I always admit that, yes, I tried it in high school and college, and I will even raise my hand and admit to inhaling, but it just never really stuck as something that was interesting for me. My career started out in the mental health world, and went on then to work for Eli Lilly for over 12 years, and then moved. When I left Lilly, it was in 2011 after Arizona had legalized cannabis for medical use, and I was taking a few weeks off to see what I wanted to do and just kind of regroup. And some friends asked me to get involved with their application for a license in the Arizona medical marijuana program. And honestly, at first I said, absolutely not, no way. I'm like, cannabis? Probably like most regulators feel when they learn that they have to be in charge of a program like this. To me, it was just something completely outside of my knowledge. I eventually, let them share some data and some research and studies about the benefits of cannabis and some patient testimonials, and decided to give it a go. So I did open the first chain of vertically integrated medical cannabis licenses in Phoenix. For those of you not familiar, vertical integration just means that we do it all. So we had a license to not only grow and produce cannabis, but also to manufacture cannabis into oils and edible products, as well as to distribute. So we ended up with 5 retail facilities, 2 40,000 square foot grows, an extraction lab, and an infused products kitchen in the time that I was with that company. So I learned all the sides of the industry up and down, and I really did fall in love with the ability and the exciting part of this plant and, you know, how it can help. But I was still just kind of mortified about the lack of quality and safety standards that existed. And so I left and sold all my financial interest in the cannabis space to start Focus as a nonprofit, with the intent of sort of bridging between regulatory and industry, that we needed an independent third party that could help guide regulatory programs and legislation, but also that could help industry run their businesses properly and make sure that they had adequate protections for health and safety within their operations. So I left there and started this in 2014, and it has been a wild ride ever since. I thought I took this out, but I think I'm going to go ahead and just talk about 420 a little bit, since I was supposed to talk on 420. First of all, it was just a riot when I was on the call with AFTO and they're asking me if I would do a Cannabis 101 course. And I said, of course, no problem. I'd be happy to, when are you thinking? And he goes, oh, how about Monday, April 20th? And I just died laughing. I'm like, really? You're going to have me talk about cannabis on 420? And for those of you that aren't familiar with 420, I thought I'd just give a little bit of background. There's tons and tons of different myths around the origins of the term, the holiday. Lots of them are really out there. One of the more common ones is that it actually started, that 420 was a police code in San Rafael, California, that meant smoking cannabis in progress. And that sort of story kind of goes that after the locals heard that the police would call that, they began using the expression when they wanted to go smoke and say, hey, let's go 420. It's not actually true, but it's a great story. The reality is the term came about in 1971 in San Rafael, California, from a group of high school students. It was 5 guys, and they were known as the Waldo brothers. Waldo wasn't their last name, and they weren't all brothers, but they had a favorite spot that they would hang out outside of school on a wall and smoke. And so they got known as the Waldo brothers. And kind of the folklore around this is that one day in the fall, when it's harvest season, the Waldos were told about a Coast Guard member that couldn't take care of his plot of cannabis plants that he had. And so they basically went out there with a treasure map in hand, looking for it, and trying to collect some of this free cannabis. And they agreed to meet outside the school at 420 after their practice, because they were all athletes. And so that just sort of came to be a thing, that they would go out and look for this cannabis at 420 after school, and they never really found it. Soon around that time, the Grateful Dead moved into San Francisco, and they were right next to the San Rafael High School. And many of the Waldo brothers had connections with the Dead through their parents or, siblings. And so as the Grateful Dead began to tour the globe throughout like the 70s and 80s, hundreds of shows all over the time, they really spread the term of 420. And it grew into this sort of global phenomenon that actually even slipped into our legal system. In 2003, California passed Prop 215, that was actually just clarifying the scope of their regulations, and that bill was called SB 420. So it's a very popular thing, and it was a really interesting holiday this year. It's always one of the biggest days for cannabis, and this year it was obviously had to be done remotely due to COVID. So there's lots of great jokes about staying home and smoking and all that kind of stuff. But all right, so let's get into some of the meat of this. So we're going to talk about cannabis, and I wanted to just give some basic, botany kind of background. So cannabis is the term used for the genus of plants that belong to the Cannabaceae family. There are 3 species, sativa, indica, and ruderalis, and there are different cultivars, cannabis and hemp. The Cannabisea family in general is just a family of like small flowering plants. Includes like 170 species, and I think hops are probably one of the better known parts of that species. So cannabis refers to those three: cannabis indica, ruderalis, and sativa. The cannabis plant itself contains more than 400 molecules. Approximately 100 of them are cannabinoids, but that really is up for grabs at this point because we're seeing new research all the time identifying new cannabinoids. Obviously, THC and CBD are the two most well-known of the cannabinoids, but cannabis also contains a lot of other chemicals in the structure. So it's got terpenes, terpenoids, flavonoids, let's see, omega-3 and 6 fatty acids. So it's a very complicated plant. It becomes even more complicated when you have to consider regulatory nomenclature and where it is. And so, you know, deciding is it cannabis, hemp, or marijuana is a big challenge. THC versus CBD. So THC has, hemp has really high levels of the cannabinoid CBD with traditionally lower THC ratios. And since THC is the cannabinoid with psychoactive properties, that's the part that will get you high, where hemp will not. But it's really important to understand that that's not a black and white situation, because the cannabinoid levels of both THC and CBD, as well as any of the other cannabinoids, can vary super widely. So we look at like all the technological advances about production and genetic manipulations and crossbreedings. And so what we're seeing out there today is such a broader range of different products than what we thought in plant varieties. So it also changes with all those manipulations and things that people are doing. It changes the level of cannabinoids in the plant a lot. And so how and when they're harvested also will contribute to that. From a plant standpoint, there's a lot of differences in growing requirements. So hemp is really hardy and adaptable. It can grow in a variety of climates and soils. It grows super fast and it's super strong. So, you know, you'll see there's many uses for hemp. When you're producing hemp and growing it for this, there's both male and female plants. And on the hemp industry, they grow both. Whereas if you're talking about cannabis or marijuana, and we'll get into those terms in a little bit, they're only using in marijuana, they only use the female plants. In hemp, they use both. The other thing is that the flowers in marijuana are used for cannabis products, but in hemp, the flowers are used to make the oil, the seeds, the CBD products. But they also use the rest of the hemp plant with, you know, the stalks and fibers, the roots, the seeds, all of that. And so there's a ton of different uses, and they look really different and they grow really different. Hemp just being so adaptable is a great thing, and it's part of the reason why the Farm Bill passed. Whereas marijuana, cannabis is typically grown indoors, has very specific controls for, you know, temperature, nutrient levels, soil, cultivation methods. Hemp can grow outside wild and does all the time. So talk a little bit more about the history of hemp. So it is one of the strongest fibers in the world, and like cannabis in many uses, it's been around for ages. I think the first recorded, and there's always a lot of discrepancies around cannabis, so forgive me for my approximations and estimates throughout this, but the first use of hemp dates back, I think, around 10,000 years is probably the biggest consensus. And the industrial use of hemp was really important to the US when we were being established. The Declaration of Independence was even signed on hemp paper. In 1619, Virginia actually passed a law that required hemp to be grown on every single farm in the colony. Hemp was also considered a proper currency in Virginia, Maryland, and there's one other state, and I can't remember, I apologize, but in 3 states. But it's important when I'm mentioning all this to understand that I'm talking about hemp and not cannabis, right? So the common uses for hemp are, textiles would be like clothing, diapers, denims, shoes, handbags, industrial textiles, think carpet, canvas, rope, tarps, netting, caulking, paper. And it's really interesting. Until 1893, between 75 and 90% of all of the paper products in the world were made from hemp fiber. Obviously, there's a lot of uses for hemp in food, and in addition to like the common, things that we see all the time, like hemp seeds, hemp hearts, protein powders, oils. Hemp can also be used to make butter, flour, milk, tofu, chocolate. Supplements are a big area. So because hemp is really rich in the essential fatty acids, and it's also a lot used in supplements for this. So you see it being added to all sorts of things, and we'll get to the legality of that in a little bit. Also building materials. So there's a lot of hempcrete houses being built now. You can use it for fiberboard, you can use it for insulation, you can use it as a substitute for fiberglass, for coatings on things. And because the plant grows so quickly and is so strong, it's a much better option for the environment. That also goes along with its uses as fuel. I think hemp is probably the most cost efficient and economically friendly fuel crop there is. And it can actually produce two different types of fuel depending on how it's processed. So it can produce hemp biodiesel, but it also can produce hemp ethanol or methanol. And so you'll hear a lot in the media today, they talk about cars being used for this and using hemp as fuel. Obviously, there's also a lot of uses for hemp around plastics because it's so strong and it's much stiffer than the traditional plastics, and it doesn't have the health and safety risks involved. And then just like we see on the shelves all over the place today, it's obviously great for, soap, shampoos, lotions. It's really high in vitamin A, C, and E, and it has antioxidants as well. So it lends itself well to those sort of cosmetic and healthcare uses. I don't know if you've heard the story of the Ford's hemp car or not. It's pretty common. It's basically on every hemp website in existence. I bring it up because it's similar to 420, just a ton of folklore and inaccuracies around the story. So while hemp was definitely a component of Ford's car, it did not even make up 50% of the materials used, even though this is not what you're going to see claimed on any website. While he announced this car and showed it off and did this kind of promotion thing, he had a couple series of strokes shortly thereafter, and it left him, without the energy to finish the project. He ultimately passed away in 1947, but I feel confident that, once Elon Musk returns from Mars, he can take up this project for him. So we will see how that goes. But I want to talk about cannabis as medicine and the history in the US, because I think that's really the crux of kind of where things are right now and some of the challenges around the regulatory side. So it's so interesting because while the concept of cannabis as a medicine has really only recently been revived in the last decade or so, it's always been used throughout history for healing purposes here as well as around the world. There are tons of written records from China and India that show that cannabis was being used to treat tons of different things, wide range of ailments for more than 2,000 years. We also have texts from, ancient Africa, Greece, the Middle East, the Roman Empire, describing their use of cannabis to treat disease. And really, it's the more interesting thing from an American standpoint, I think, is that like for most of American history, growing and using cannabis has been legal under both federal law and the law of states. And even, so around, let's see, the 1940s, I think, marijuana's therapeutic benefits or potential really became recognized by physicians. In fact, by the year 1850, change this, cannabis was actually listed in the US Pharmacopoeia as a treatment for lots of different afflictions. I put them up here for you to look at, so I don't need to read through them all. But it's, you know, interesting when you start looking into the history of this, that they used it for children, for you know, cough medicine and to sleep. I mean, it was sort of used as everything. And if you think about how cannabis is being used today, a lot of people that I talk to that aren't familiar with cannabis or the history or the plant are just like, how does it treat everything? I don't understand. It's such a big range of things. And so when you look at what it was used for historically, it sort of aligns with what we're seeing today. But all of that changed as far as the US goes by 1906, basically. I think in that year we started to see a lot of regulations and different restrictions being required of cannabis products, labeling them as poisons and different things. In 1914, the Harrison Narcotics Tax Act was passed. The idea behind it was to just bring state laws in accordance with federal laws, and the goal, obviously, fighting drug sales and abuse. The act itself provided for the registration, and I'm going to read this because this is actually from the act, provided for the registration of with collectors of internal revenue, and to impose a special tax on all persons who produce, import, manufacture, compound, deal in, dispense, sell, distribute, or give away opium or cocoa leaves, their salts, derivatives, or preparations, and for other purposes. So this act actually put a tax on these products. It's interesting because the Harrison Act is very much tied to the history of cannabis prohibition, yet nowhere in the act itself does it mention the word cannabis, hemp, marijuana, etc. So from there, things continued to progress. In 1930, the Federal Narcotics Bureau was established, Farm Bureau, and it was established under the Department of Treasury. The idea and the goal of this was just really to concentrate and consolidate the Narcotics Board and the Narcotics Division of the government. Henry Anslinger was appointed as the first commissioner by President Hoover, and that bureau really lobbied for really harsh penalties for drug use. Ultimately, this bureau is sort of claimed and credited with, or blamed, I guess, depending on who you ask, with criminalizing drugs overall, and especially marijuana, that we'll see as it comes through the next act. So the Marijuana Tax Act was passed in 1937, and it really was the first step by the government to begin to ban cannabis. It was designed to curb the traffic of marijuana, and they were going to do that through heavy taxation and obviously enforcement. This is the act that legalized the use or the term marijuana, and you'll see on the stamp here that it's spelled M-A-R-I-H-U-A-N-A, which is how that term came. But it was then changed to marijuana as we spell it today. By the 1940s, as things continued to progress, all 48 states had enacted some sort of law to regulate marijuana. There was a super rapid decline in the use of cannabis as medicine, partially because of the things I've just mentioned, but also because we have to consider that, you know, the development of aspirin and morphine and other opium-derived drugs that helped to replace marijuana in the treatment of pain and other medical stuff. In the end, Anslinger ran this bureau until 1962, and at that time, it was taken over by Henry Giordano, and I can't say his name, who was the commissioner up until the time when the Narcotics Bureau merged with the Bureau of Drug Abuse and Control, which was under the Food and Drug Administration. So we moved that together. The merger formed the Bureau of Narcotics and Dangerous Drugs as an agency under the Department of Justice. So it went from food and treasury to justice. And just for those that don't know the history, the Bureau of Narcotics and Dangerous Drugs is actually the predecessor agency of the current DEA. So it's really cool to kind of watch how all this plays out. It wasn't really until the Controlled Substances Act was passed and signed into law by Nixon in '70 that cannabis was officially outlawed, even as a medicine. The act itself put all substances in some regulated form under existing federal law into one of 5 schedules, which most people are familiar with because they're still very much in existence today. The schedules are based upon the ability, the characteristics of the drug itself. So the substance's medical use, the potential for abuse, the safety, the dependence and liability issues, that kind of stuff. And although there's been considerable attempts over the years and many, many lawsuits to try and reschedule cannabis to a different level under the CSA, they have all failed, and as we well know, it's still in effect today, which is part of what is causing this huge gash between, federal and state regulations. Because, over the last decade, and really beginning in 1996 in California with Prop 215, states and local jurisdictions have continued to implement policies that are in direct conflict with this federal law, which is, where we see cannabis in the US today. So let's flash forward to the Farm Bill. So December 2018, the Agricultural Nutrition Act was passed. And in that act, the Farm Bill actually removed hemp from the Controlled Substances Act completely. So it made it an agricultural commodity, and then it changed the federal oversight of hemp away from the DEA and over to the USDA. It also took away the definition of marijuana in the United States from being related to hemp. So interestingly, we now have this situation based on the Farm Bill where we recognize 2 different types of cannabis, marijuana and hemp. But it's more of a, how do you say it? It's semantics and nomenclature more than anything else. So we've decided that, hemp with a certain level, hemp is hemp if it has a certain level of THC or less. The Farm Bill basically took the marijuana out, the scary out of marijuana and legalized it. And that's really what it did. So now as the Farm Bill has come into play and everyone in this industry is jumping around to start hemp businesses and hemp farms, and CBD products are everywhere. There's just been it's just been such a confusing thing. I mean, there's so many conflicting laws and oversight. The operators weren't ready, and there's a lot of scrambling going on. So we've seen, the USDA came out with their rules. They had to update them rather quickly, within a couple months, just because they realized that they were too stringent. They had too many requirements that wouldn't work because they were still related to the old DEA type regulation of hemp. And so the other part of that confusion, excuse me, I need to cough, is because it wasn't just the Controlled Substances Act that was regulating cannabis. So removing it from the Controlled Substances Act within the Farm Bill was one thing, but there's still a lot of other existing laws in a place that are conflicting, and there's a lot of confusion around it. So the Food, Drug, and Cosmetics Act gives the FDA the authority to oversee the safety of all food, drugs, medical devices, cosmetics. Specifically, Section 301, Chapter 2 prohibits the adding of any active ingredient of a drug product into a food or beverage, including animal products, any that is intended for interstate commerce. It also prohibits products containing active drug ingredients from being marketed as dietary supplements. Well, this is a huge issue because, as you know, CBD products are being pushed out and available everywhere now as dietary supplements, as food products, as drugs, with just extensive claims as to, you know, their efficacy and what they're able to treat. But because CBD was already a registered active pharmaceutical ingredient in 2 FDA products, that's Sativex and Epidiolex, you can't put CBD into that, and that section 301 chapter 2 is in effect. And then THC itself is also already an active pharmaceutical ingredient in 2 other approved FDA drugs. Those are Marinol and Syndrose. So there's where the conflict comes, because they, you know, people want to put this in everything, it's legal, but you can't because there's these other rules in place. The Public Health Services Act also comes into play with all this, and this act basically gave the FDA authority to take legal action to stop the interstate commerce of any products that present a health and safety risk. And so obviously, as we move through this farm bill implementation and going through the next phase of this industry, we know there's a lot of health and safety risks. We know that there's a lot of unfounded claims, and we know that there's a lot of products crossing state line and jeopardy, you know, in violation of this interstate commerce rule from the Public Health Services Act, which basically just leaves cannabis laws today about as clear as mud in the U.S. It's a frustrating topic for sure. It's frustrating to me, and this is where I spend all my time. It's also frustrating, I know, you know, to patients and consumers and the public, because they don't know where to go to get good information. The operators themselves, you know, there's a wide range of sort of mentality within them, but, you know, some are here to just see this through and consider it a green rush and make a lot of money. And others are really in this because they believe in the product and the wellness capabilities and really want to build a safe and legal, sustainable industry. And then, of course, there's the regulatory folks, like everybody at AFTO, right? And as you're being forced, whether it's through voter initiative or, you know, legislative passing, that you have to regulate this. It's a very, very difficult situation for everyone. I think it's important to understand, too, that there's a lot of stigma and fear that comes along with it because it's been outlawed so long. So even if we don't realize that we have a stigma or some kind of fears around the topic of cannabis or cannabis products or cannabis legalization, the reality is it's there. And it's such an interesting thing to watch be into play, because cannabis is one of the few things I've seen that it really just creates this visceral reaction in people, whether it's positive or negative. It's just always strong. And you see that, you know, with all of the excitement, enthusiasm of the industry and how vocal they are, and certainly the media getting involved. But you also see it on the other side, where people are just really afraid of it and still not able to sort of wrap their mind around this as a potential medicine or a potential wellness product that is not going to, or a potential food even, that's not doesn't have that stigma associated with it. And I think a lot of that is about education, obviously, and that's part of why we're here today. So we'll talk a little bit about how cannabis works in the body and give you some background. I'm going to say up front, I'm not a scientist, so I don't want to get too in the weeds with this, no pun intended. I just want to kind of cover the basics. So we have receptors and cells and signaling systems throughout our body. The endocannabinoid is one of those systems. Its primary goal is just to create homeostasis in the body. It's made up of 3 parts, so I'm not going to say that third one, but endocannabinoids, adenine, and the last. But it also has, you know, other things involved in it too. The interesting part is because the endocannabinoid system creates homeostasis in the body, it can control many, many processes, which again gets back to, why does cannabis work for everything? Why is everyone trying to treat everything with this? So think about things like temperature control, mood, sleep, inflammation, the transmission of pain signaling, production, libido, metabolism. And the reason it's called the endocannabinoid system is because, I mean, endo obviously refers to endogenous, which means within. And so endocannabinoid system literally just is the cannabinoid system within. It was named by that because cannabinoids are in the plant, but it's endogenous, so it's the endocannabinoid system. And it actually wasn't discovered until 1964. That happened at University of Jerusalem by an Israeli natural products researcher named Raphael Mechoulam, who's an amazing guy and still does a lot of presentations and is still out there discovering cannabinoids today. He just had a pretty exciting announcement last summer. So the endocannabinoids that are in our body are very, very similar to the cannabinoids presented in the cannabis plant, which is, again, part of the naming. So there's two primary receptors, and again, it's a signaling system, so cells are signaling one way to different receptors. So there's two primary receptors that are responsible for the endocannabinoid activity. They're found throughout the body, CB1 and CB2. So CB1 actors are actually, they activate through THC, and they're primarily found in the brain and central nervous system, whereas CB2 receptors are much more activated by CBD, and they're primarily found outside of the brain and central nervous system. So one of the things that really leads to determining the effects of cannabis is what receptor it hits, right? Which particular receptor it's going to bind to and where. Obviously, we know that there are lots of different factors that go into how cannabis affects you, but certainly this receptor signaling and activation is one of the more important ones from a scientific standpoint to really understand that. Let's see. Like most drugs, cannabis is metabolized and eliminated through enzymes in the liver. That specific system of enzymes is called the cytochrome P450. It's just a family of enzymes, and 3,4-A is a part of that 450 system, and it's actually the most prevalent enzyme and pathway in the liver. So when we take any type of pharmaceutical drug, over 50% of prescription medications are actually metabolized by this same pathway in the liver, which is important because when THC and CBD are both metabolized by that same system. And so when they go through the system, it's like competing for space. And so you really have to think about what's happening in the body internally to understand, you know, the effects of the medication as well as adverse effects and whatnot. I think when THC originally comes into the body, and you can see this from this slide, it's psychoactive, right? So it comes in as delta 9. It makes two changes. So then it turns into hydroxy THC, which is also psychoactive, and then eventually into carboxy THC, which is not psychoactive. And it's just really important to think about the interactions. And I think this is where a lot of the research being missing is a problem, because we get a lot of people reporting things in the ER, and you know, the reporting is shoddy at best. It's not always, you know, patients aren't willing to tell the truth if they listen, you know, they use cannabis necessarily, and there's no good federal way to track all this. There's no systems in place, and obviously we're seeing a lack of those kind of systems with tracking COVID recently. So there's no wonder it's not in place for cannabis. But also another way that really affects how cannabis affects you is through how you ingest it or inhale it, and the delivery method. So it determines, like, the way you inhale it or if you eat it determines the pathway that THC will take throughout the body, and then eventually what receptors it will end up at. Excuse me, I got a cough again. So when you inhale cannabis or smoke a joint, which is the left side of this picture, or a pipe or whatever, THC enters the bloodstream through the lungs. It's just absorbed through the lungs. From there, it travels straight to your heart, and then the heart pumps it through the body in the blood, allowing it to bind to the different cannabinoid receptors throughout the path. So when somebody smokes cannabis and they start to feel that high, that psychological high that's associated with it, it means that the THC molecules that they inhaled have moved out of the lungs into the blood and have passed that blood-brain barrier. And they've begun to bind to the receptors in the brain. And that's where you see this psychological kind of effect. It's really different when you ingest cannabis, when you eat it as an edible. It enters the bloodstream through the walls of the stomach and the intestines, and it travels directly to the liver. And it's actually, most of it is eliminated and metabolized before it ever has a chance to reach a receptor. So it's only after it comes through the liver that it can, that the THC and any of the metabolites of THC will get into the heart and circulation of your body, which is one of the reasons that it's a challenge to dose edibles, because it's a while. The onset of action is not quick, and you see a lot of newcomer new cannabis try an edible and it doesn't work, and so they'll end up taking another one in a half hour or 45 minutes because they don't feel the effect, and then it's too much, and then those are the people that end up in the emergency room panicked, and understandably so. Let's see, then, so we're talking about drug interactions then, and obviously there's many, and I'm not a doctor and I'm not going to list all of them, but I wanted to hit some highlights and kind of think about this. So as cannabis is fighting through the cytokine system, the 3,4-A system, it's fighting with other drugs. So it's basically who can pass through the tiny little bridge fastest, and so whoever wins, it affects the way those drugs affect you. So there is a potential for cannabis to either accelerate or inhibit the effects of any other drugs. So any drug that's already inhibiting of that cytochrome 3A4 system will slow the metabolic process, which will make drug concentrations and then an increased risk of side effects. So some of those are like NSAIDs, ibuprofen, naproxen, that they will actually suppress the effects of THC. Antivirals are the same. They can decrease, cannabis can actually decrease the effectiveness of the antivirals. But then there's other drugs like the old school tricyclic antidepressants, amitriptyline or Elavil, and then other like muscle relaxers, benzotypes as Flexeril, that can actually increase the psychoactivity of the cannabinoids and create enhanced effects. That can happen also with sedatives. Cannabis can really increase the sedative properties of these drugs, and that includes all the herbal preparations as well. So anything, valerian, melatonin, GABA, all these things are out here do have a potential to interact with cannabis. And I think, from a health and safety perspective and a medical perspective, this is just critical information that is not shared, right? We don't have this information in our medical schools for the most part. There's not a good, one emphasis on the education that's necessary for this industry, and it creates a lot of problems. I think, other kind of drugs to really watch out for with this, as far as events go, more side effects and stuff, is anticoagulants or antiplatelet drugs. So cannabis can change how those drugs are processed, when it could lead to, potential bleeding risk. Another big one, just because of the sheer number of people who take selective serotonin reuptake inhibitors, SSRIs, better known as antidepressants, Prozac, Paxil, I used to sell one of them at Lilly. Those have the potential to increase mania when used with cannabis as well. I think overall, we don't have enough data on this, and research has historically been so limited because of the federal scale. But we're getting there. I mean, this industry has been growing like decades. Over the past 10 years, and certainly that's true in the US, but also globally. We are all watching the United Nations and the World Health Organization go through the process of trying to reschedule cannabis and CBD and having those debates over the last couple years. So the word is still out. We definitely need more information. I'm going to skip now back to sort of here we are in the States. So this map is April 2020. so last month. It doesn't reflect any laws or like pending legislation. So this is just looking at where things are in the beginning of April. And I think, to me, there was a couple things that stand out on this. I mean, obviously, there are there's only 8 states that have fully illegal, have not passed any cannabis laws whatsoever. And those are Alabama, Idaho, Kansas, South Carolina, South Dakota, Tennessee, Wyoming, and Wisconsin. There's actually more states that have legalized cannabis for adult use or recreational use than there are states without laws. So there's 10 of those states that have legalized it for any purpose. Colorado, DC, Illinois, Nevada, Maine, Massachusetts, Michigan, Oregon, Vermont, Washington. So this movement is going, and I think the train's out of the station at this point. If you're not already aware of that, I feel like that's one good takeaway for you after this conference. I think, and it's also important to know that there's quite a few other cannabis initiatives that are planning to be on the ballot in 2020. Some have actually already passed. Others are, due to be on the ballot in November, may or may not happen due to the pandemic. But, Alabama, Arizona's got the adult use on in November. Connecticut's adult use bill was introduced, but I believe they've postponed that until next year. Kentucky actually just passed medical cannabis. Mississippi will have medical on the ballot in November. Montana, I know they submitted some legalization initiatives in January, but I really am not clear on the status there. New York, I'm sure we've all heard Governor talk about how legalization was included in his budget. I think that's being tabled just to coronavirus. Oklahoma's got adult use on the November ballot. South Dakota, Tennessee, a possession law was introduced in Tennessee, so it's not even a legalization bill, it's just to decriminalize possession. And then Virginia also signed a decriminalization of possession of cannabis on April 11th. But then in addition to that, there was passed a resolution to study cannabis legalization and regulation by 2022. So you can see where this is going, and that it's everywhere. And it doesn't look like it's slowing down. And so that kind of brings me to what we really talk about most of the time, is just the regulatory challenges around this. There's obviously lots of moving parts around the cannabis legalization movement, whether it's, all the different states having different regs, whether it's the different times, whether it's medical, adult use, and all of those create regulatory challenges galore. There's a ton of typical challenges that I am going to talk about, but the first one I really want to mention, because this is not something that you hear about a lot, and I truly believe it is the key to all this, is that we need to see more information, and this is regardless of state or country, about the safety of ingredients and additives and solutions that are used with cannabis. There has to be 100% approved and safe and fit for purpose for human consumption. And it's not just with cannabis infused products, right? This is with any cannabis flower product. We've got all these industry players out here, and some with science backgrounds and some with not. And they're all just moving ahead as fast as they can. And it's normal, right? Science and industry really always move fast, where regulations are slow and fall behind. But I think that we're seeing a lot of the fallout because of this, and because of the lack of federal regulations. When we, look at things like the vape crisis, right? That was a huge problem. Our last catastrophe, I guess, if you will, seems to be long forgotten now. But when that came down to it, a lot of what they found out is there's no good manufacturing practices within these operations, right? So in typical regulations for food or drug, there would be good manufacturing practice guidance for the industry. They don't have that. They don't even know what it is most of the time. So getting that kind of help and guidance to the industry is really important. And that's where focus really comes in. That's our purpose. We wrote the standards. They're cannabis specific good manufacturing practices. And our goal is to really help give operators a way to assure that they're providing a safe workplace and, safe, quality, consistent products, and that regulators have a better way to understand what's going on and make sure that they are providing adequate protections for health and safety within their programs. There's no supplier qualification. So in the vape crisis, this is, they're buying vitamin E oil, and then it's not fit for purpose because nobody, we put it in cosmetics all the time, but what happens when you put it into an aerosol and inhale it into your lungs? I think the nomenclature about this is important too, right? Like, we just can't decide, is it an active ingredient? Is it, adulterated? Is it just an ingredient? All this kind of stuff. So there's really some commonality that needs to be decided, I think, for the straight path forward in all this. There are definitely problems in the market. So I'm sure you've heard about them. I won't go into all of them. I use this picture because it came from an Arizona dispensary that one of my employees actually grabbed and took home, and she ate one of them. It was a 3-pack of truffles, and she put one on her nightstand, and it fell off the bed, the second one, and fell off the bed, and it hit the ground, and it broke into half, and you can see the truffle, the mold is in between the chocolate and the ganache, and it's all solid. And this brand has been around in Arizona for quite some time. They had just started this new line of truffles, they're exclusive kind of thing, but it ended up being pervasive throughout most of them. It turns out they didn't do any stability testing. They didn't control their storage and transportation, and so these things are happening all the time. Those are not necessarily considerations in the cannabis programs today, and there's also not a lot of enforcement on it. In this particular situation, the truffle was taken to a lab and tested, and taken to another lab and tested. The results, along with the photos, along with the sample, were taken down to the department that regulates cannabis here in Arizona, and they, came back a few days later and said, yeah, we can't do anything about this. And so it was brought up to the local FDA regional office, I guess. But so one of the challenges in regulating is that who's got the enforcement capability and what that looks like. And we'll talk about that more in a minute. I don't know if you have seen, but there are also a lot of lawsuits happening right now from all sorts of different ways, right? So there's some lawsuits that are happening from employees. There was one of the largest cannabis companies in the U.S. is called Harvest Health. They're actually based here in Arizona too, but they're all over the place now in multiple states. But they have an employee that has just filed a lawsuit because she was hired to open all their new stores, and when she would go from store to store, there were all these compliance violations, and she would mention it to the manager, and he would say, but he literally watched the compliance violations happen and do nothing. And she's like, how am I supposed to complain about this? So there were things, there's a ton of different things, but I think one of the more important parts to mention, outside of obviously diversion, but is like they were literally storing vape pen cartridges in the little squares that you push on the ceiling that you push up. So they'd run out of space in their dispensary, and they were just pushing them up there in the air vents or whatever, in the roof. Clearly that's not good from a safety standpoint, but they couldn't get, she couldn't get anybody to do anything about it at the facility, at any of the facilities. So she ended up having to file a lawsuit. And I think we're going to see a lot more of those kind of consumer lawsuits. We've seen one already for mislabeling of CBD from a consumer perspective. And I think it's until this gets cleared up, we're definitely going to see more. So let's talk about the rules and what's important to think about there. I think determining the barriers to entry is always going to be super important. You have to balance the issues with the supply chain with also providing adequate access. But you really need to be careful because we've seen states like Oregon really go overboard. And obviously, like if you're looking at the production and consumption numbers, an annual surplus of 785 to 1,625 pounds is enormous. And what do you do with that? It doesn't just hurt for diversion purposes, right? It also hurts the industry. Not only is it all there and you have to deal with the stockpile and everything, but it really drives prices down. And so what happens then in the legal market is then the black market comes up. And I think really understanding from a regulatory perspective or a legislative perspective, it's really important to have a very thorough analysis and effective analysis conducted to make sure that you're not only just assuring access, but you're also preventing some of these problems. I see a lot of the rules being made that are, again, that stigma and sort of fear driving behind the rulemaking. So cannabis laws across the country have the most extensive security requirements. And it's been really interesting since the Farm Bill passed and we've started working with hemp clients as well as cannabis clients. And we don't have those same security requirements for hemp clients. So when they go through our standards and work on their third-party certification, we just go with the security requirements of the state because it's no longer illegal. And I think, there's some interesting points around that too that have come up with COVID, right? So we'll get more into that. I don't want to get too off track because I don't have a lot of time left. But so program rules, again, I think you have to consider a ton of different things. But I think one thing that is not listed on this slide that is important is thinking about where the information is coming from, right? So most states that have legalized cannabis, either for medical or adult use, initially it was happening through voter initiative, which was great from an industry perspective, but really created a lot of problems from a legislative and regulatory perspective, because those bills as written didn't have, and that are passed into law then, they don't necessarily have adequate protections for health and safety. They don't necessarily think out all the challenges of how those regulations would play out. And they're not actually written by people that have the knowledge or background to be able to really think that through in advance. And so you see industries with these huge problems in California is just a terrific one. I don't know how you wouldn't have been able to hear about it by now, but I mean, they've really, they wanted to get, they had a medical program since '96. They really wanted to put it into a strong regulatory program and regulate both adult use and medical, but they've gone overboard, right? So they've done so many different things throughout their licensing and program rules that have really negatively affected the industry. And it's costing them all their money that they, the money that they estimated in taxes is not coming in. And if a legal product is 77% more expensive than an illegal product, it's going to be pretty hard to stop somebody from going the other way. And especially right now when we've got so much going on with unemployment and everything else. So I think really considering those, like the licensing fees can be too much. In Missouri, it's a perfect example. So they took in almost $3 million as the state just in applications. So all this, 75,000 here, 25,000 here to apply. It doesn't guarantee you a license. It's very competitive. And then what happened is the scoring was done, and they've now got bills going through their legislature to just give everybody a license like they did in Oklahoma, because they don't really have any way to work this out fairly otherwise. California, again, is always a good example. I mean, it's so big and broad, but in California, the licensing fees, some of them are reasonable, some of them are super expensive, but the problem is it takes 9 actual individual licenses to get a regulated product on the shelf, and most operators don't have 9 of those licenses. That is a supply chain right there. Not well managed, certainly not well researched, and definitely not coordinated. So, you really want to think about that kind of stuff when you're doing this. Like, how hard is it to get a product on the on the shelves for consumers? Because there's been, a gap in that in California for sure. I think taxes are another important thing. Obviously, California is, again, a good example for this, that, their taxes are so high. And once they legalized, $500 million less was spent on legal cannabis the year after legalization than it was before. So that's just insane numbers, especially when you think about states doing this to actually legalize cannabis to drive tax revenues. I personally, my feeling on that is it's a little bit backwards. You have to look at it from an economic standpoint, and why do you try and regulate an unregulated product, right? The first goal has always got to be to control that market. Secondary benefits can be taxes, but when we go into this with the idea that this is a tax saving, lifeboat for a state that really needs some revenue, things get skewed and things aren't looked at correctly. So you want to keep that in mind. It's especially a problem even for operators too. So consumers don't want to pay the tax, but operators have a hard time in this because they have 280E tax rules that came back from the Harrison Act when it was, prohibited to deal with these things, that cannabis operators are honestly not allowed to take any deductions like traditional businesses are, with the exception of cost of goods sold. And considering everything's more expensive in this industry, it really does put a burden. So that's part of where you hear a lot in the media about, excuse me, banking and taxes and getting those things cleaned up, because it's, as this industry grows and continues to develop, it's really important to get some of those things in place so that the safety of employees and patients and operators and the public are not jeopardized. Some other contributing factors, I think I talked a little bit about voter initiatives that they don't really, most of them that I have seen do not assign effective enforcement. In Arizona, it's a perfect example. I told you about the moldy truffle. The Department of Health Services, because it was passed by voter initiative and it has to have a 75% rate to turn anything over. We've had a program for almost 10 years and we can't get anything done in it. It took 9 to get a testing bill passed. And then when that happens, politics get in the way as well. I think inadequate training across the board, whether it's for labs, operators, inspectors, patients, consumers, is just really a big gap. And it's adequate training and appropriate training too. There's a lot of them out there. It's a big business in this industry, but we see a lot of problems with lab testing, and even labs that are ISO accredited aren't able to give the same results twice and don't give the same results as their neighbors. So it literally comes down to training in so many ways. And I think also, if you think about it from the regulatory and inspection, I have a document file of all the state audit checklists for cannabis businesses. And it's amazing to me when I look at them. And even the most extensive one is like maybe an eighth of the audit list Focus goes through when we certify a client. I mean, it just really doesn't even compare. So I think part of it is making sure that inspectors and regulators know what to look for and understand the life cycle of the plant, and also the potential for problems and diversions within that. And then communication is a really big one. And obviously this is always a problem, not just in cannabis. We saw it before 9/11, where we didn't have a good law enforcement communication strategy for, federal, state, and local, and had to get that in place really soon. And we've seen a lot of states struggle with putting together way too many different agencies to oversee their cannabis programs. California is a perfect example again, and they're actually going through the process of trying to consolidate some of those right now. So you really want to think about what that looks like up front. And I think this is always my favorite saying: just because it's legal doesn't mean it's safe. And while all of this stuff that we're discussing is obviously a huge headache from the legislative and regulatory side, I think the real issue is the market being flooded with unsafe products that are making illegal claims about their efficacy, and people are taking them and not knowing, without enough data on the interactions or the effects of the drugs. And all consumers have rights, and in any other industry we would assume that a consumer can go into the store and buy a television or buy some food, and it will be what is on the label, it will do what it says, and if not, that you could go back. That's just not a thing in this industry. And I think that's really where we see the biggest problems and gaps. And that's true across the board, whether it's THC or CBD products. It really doesn't make much difference. So what's the path forward? I actually have no idea. I can't tell you. I can tell you it's not as straight as that little path in the photo that I chose. But I do think it's going to get more critical that this gets decided and worked out now. I mean, especially as COVID has occurred and cannabis businesses across the country have been deemed essential. They're being considered like a pharmacy that provides medicine. But think if your pharmacy that provides medicine didn't couldn't give you the same Lipitor pill twice in a row, that it was different from month to month. Is that medicine or not? And if we're going to deem cannabis essential as medicine, then we also have to put the right controls in place for quality and safety and the manufacturing and production practices. And then, we also have to think about, okay, if this is an essential business that's being, able to operate when so many businesses aren't right now, what does that mean that they don't have banking and that they still have tax issues, and how does that equate? They don't have access to the SBA loans. That's been a big thing that some states are kind of taking back. When you look at like what's going on at the federal level, I think this picture kind of sums it up. We've heard lots of testimony and different hearings about, getting this done and what needs to happen to move it forward. And it's like the regulatory agencies want Congress to do something. And they say this when they're in these hearings. And then you hear Congress come back and all the senators and representatives are saying, well, we want the regulatory bodies to do something else. And really, it's going to take collaboration. And clearly that's difficult in our country these days. But I think, if we focus on public health and the safety of people, it needs to get done. I know FDA is working on rules going forward, and USDA, I said earlier, had come up with their hemp regulations and then just had to update them recently. But I do want to point out, it's not just the federal agencies and legislators that have a problem with this. This industry is part of the problem too. There is a lack of leadership in the industry. There's really no unified voice, while gazillion of trade association, they don't function as a traditional trade association for the most part. They're not there to really help the industry be successful as much as generate money and have conferences and that sort of thing. Most of the time, as they're crying for federal regulation and legalization, they're also, the other side of their mouth is asking for self-regulation. And I have seen firsthand that self-regulation is not effective in this industry. I think it was always a weird goal to talk about that anyways, given the history of cannabis as an underground illegal market. But they're not ready for the regulation either as much as they demanded. And we've seen so many examples of that in the last month or so. I mean, hemp companies are all scrambling ever since the Farm Bill. They're not ready. They don't have any idea how to get their facilities ready. In Brazil, just this last week, they have allowed a medical program in Brazil, and it's very much pharmaceutical based. And there's one person that applied in the world out of any of these companies because no one's ready. No one can meet the good manufacturing practice requirements around that in Brazil. And same thing, we've seen a ton of major Canadian publicly traded companies failing. Germany, who the government is actually in charge of their cannabis program, has been returning product. So there's lots of issues and lots of things that can be addressed and worked on. And I think they all really pretty much center around just keeping people safe. What is it going to take to do that? Again, I'm not sure that I know the exact answer. I think these are a few things that we need to think about, right? The communication. Obviously, nomenclature is part of that. Is it an ingredient? Is it an additive? Is it an API? What can you mix with it? Are they, fit for purpose? But I think communication is, again, also about talking between regulatory agencies and legislators and industry and science and really figuring out, the best way. There's a lot of smart people in this space now, and I think there's a lot of opportunity. Obviously, education, that sharing of the knowledge is huge, and getting some consensus around education. Research, I don't even think I need to go into. And then that collaboration. And I think collaboration is important to think about, not just nationally or on the state level, but this is globally. I mentioned the UN and WHO earlier, but this is a world issue. It's not a US issue. And we have to consider what we are doing in our country and how that will affect us as an industry, as our products and stuff, and in how we can participate in global trade, as so many other countries are already able to import and export. And I know all of it's hard, but I think it has to happen. I think that's where I'm going to leave it today. I had something else I was going to show, but I think this is good. We've got about 10 minutes left if there's questions. And I also just wanted to mention one last thing. if anyone's interested in seeing the focus standards, we actually sell them, but we've agreed with AFTO to have them listed on the AFTO website. There'll be some downloads, so you can download the requirements of the standards, and then if you're a regulator and you're actually looking to get a full copy of the standards, Focus is here to help, and we want to get them to you. So there'll be a link to email us, and we'll be happy to send you over a copy as well.
And Leslie, that will be available here in the next few days, right?
Yeah, exactly. Tomorrow, probably, or Friday.
Okay. So Leslie, we've got a few questions. The first one is, can you speak briefly on the myth of marijuana killing brain cells?
Not educatedly enough to probably feel comfortable doing it on this call. I mean, it's a research thing, and it's not to say there's no research, because there's a lot of research around the world, and anybody that's from a science or medical profession knows that it doesn't matter where the research is done, as long as it's following international standards and done properly. But there's still just so much unknown. Obviously, it's affecting brain cells, and we talked about how it's metabolized and then it goes through the blood-brain barrier. But I don't think that we definitely can say either way. There's still very much questions about how it affects people with mental illness, that in adolescence, we know that adolescents, it can stunt their growth and their brain development. So it's part of the reason we try to protect children so much. But I don't really feel much comfortable saying more than that. I just rather not give you bad information than give you no information.
Okay. So another question, any positive outcomes from states that opted to decriminalize?
I mean, I'm not sure how to answer that question. I think that there's lots of positive things about decriminalization. I mean, if nothing else, think about just the people that are flooding our prisons that are there for some minor cannabis violation for 30 years just because of the laws back then and stuff. And then think about COVID and all these people infecting each other and having to get people out of the prison. So I think anything we can do to really minimize the damage done by the war on drugs and get people back to living lives is huge.
Okay.
Yeah.
All right. Is there data in reference to cannabis use in relation to age? Smoking in teens versus smoking in adults, for example?
There is. I don't have it on the top of my head, but there definitely is. I mean, like I said, it's an interesting conundrum because research is what everybody's asking for right now. But if you look at the research that is out there, there is a lot. Now, some of it is not really good, solid clinical trial data that's sort of gold standard and what we use to make decisions. But there's a lot of anecdotal research that really needs to be followed up on and driven down. I think the other part too is because cannabis has been illegal in the US for so long that much of the research was sort of skewed because what they were looking for was the negative, the outcomes of the study that were powered to find the negative parts of cannabis and not look at some of the other things. And so we definitely need to get back through that and address some of those. But definitely age-related data is out there, and if somebody would like me to send them that, whoever asked that question, just send an email through that website on the slide, or you can email info@Focus Standards and we'll send it over to you.
Okay. Another question is there a reason why cannabis was targeted for illegalization in the first place? Did it have to do with growing big pharma, lack of oversight in production, or perhaps mafia involvement?
I think all those things have been brought up and discussed. Whether or not any one of them is true, I mean, there's definitely a lot of history there. The laws really started around opioids and cocaine, opium and cocaine. So, like I said, cannabis didn't get sort of singled out into any of those acts until later. But I think, I think all those things play a role in it, right? I mean, the war on drugs was kind of to beat the cartels and all this stuff coming in our country. So I think that there's some truth to all of it. It's a matter of deciding what exactly is the truth and determining something that's the challenge.
Okay, and we have several other questions, so maybe Leslie, you and I can talk about getting answers to the rest. But
Oh, of
I
course.
want to finish with this last one. Because of the variability of cannabis products you describe, what sort of testing frequency would you recommend for a manufacturer making an industrial hemp extract intended for human consumption?
Testing. So my particular feeling and belief system around this is that testing is only one aspect of creating a safe quality product. And unfortunately, most of the state cannabis regs, and this is not hemp, but cannabis, have utilized testing as their pretty much sole option for controlling quality and safety. But it's a very well-known fact that you can't test quality into the product, right? The quality is either there or it's not by the time that product goes out for testing. So I think it's much more critical to focus on how it's being produced, what are the practices, what's being monitored and tracked, and how it's being manufactured, and what protections are in place to assure no cross-contamination or other problems with bacteria or molds or anything come into play during those operations. Certainly testing, I don't want to say is not important. I know it's going to always be required from a hemp manufacturer. It'll be required from the producer when it's actually harvested, and then once it's put into a product, you'll definitely want to test it as well. But the real way to assure that you're bringing a safe and quality and consistent product to market is by controlling your business operations practices through good manufacturing practices and standards and documentation.
Okay, and Leslie, I was wrong. I didn't realize that we're actually going until the bottom of the hour, so I apologize. So we have a few more questions.
Okay, no problem.
Another one is, does the cannabis regulatory job market have any certifications for upcoming code enforcers?
Not that I know of.
Area for opportunity.
Yeah, we've been talking about on the cannabis committee, like one of our charges for this next year is we'd really like to put some tips for auditors together, or tips for regulators, kind of what to look for. And we're going to do some video tours to kind of give people an inside view of some of these facilities and to get a firsthand look on, some of the challenges and where they get involved. Focus does our own regulatory training for states or divisions of state governments or whatever, where we'll come out and create a training designated for that specific regulatory body based on your rules and the standards and good auditing practices and whatnot. But I don't know of anything that's like an accredited true thing. I mean, there's a gazillion trainings in the industry, but a lot of them are just people that have been growing cannabis for a while and said, hey, we'll certify you. So I don't know that they're necessarily providing a ton of value.
Okay. From a standards perspective, is there any reason to regulate hemp versus marijuana differently? That which is intended as a food product.
So again, this is an opinion, but I had to make this decision when we set out to develop standards early on. And obviously there wasn't nearly the big division between hemp and cannabis at that time. But when we looked at it, we were looking at it from a medical versus recreational use. And either way, whatever the reason that you're going to consume cannabis and however you're going to consume it, and whether that cannabis is hemp or marijuana, the idea is that it should all be safe, and it's all a consumer good, and you have to put adequate protections into that. So in my opinion, no, what is safe and quality and consistent looks the same, whether it's a hemp product or a cannabis product. And to me, that very much includes food regulations. It also includes some supplement regs. It also includes pharma regulations and ag and OSHA and all these different things. So one of the challenges I think with cannabis really is, is it a food? Is it an ag product? Is it a supplement? What is it? Is it a drug? And because it hits so many different things, that's part of the challenge. And that was really the impetus behind the standards. I mean, we use Code of Federal Regulations for, what is it? 110, 11, 117, 210, 211. We use FSMA, HACCP, OSHA, all this stuff. So we had to just pull things in from and what was appropriate. And that was kind of the reason for focus standards, because it was really hard from an operator's perspective to understand what all rules apply. And so the answer, I think, is no, there's no difference.
Okay. What are the top health injury hazards associated with cannabis products?
So, it's people with compromised immune systems getting unsafe products. We've heard about like crazy stories about somebody taking a cannabis edible and jumping off a balcony. That's really not a cannabis risk. That's something else. So, but I think when you talk about it, we see all the same risks in cannabis, whether it's, the hazards, whether it's from like a food safety perspective, whether it's mold, biological stuff, it's all the same. If you think about how corn is grown, it's harvested in the crop, but then it's extracted and it's put into all different food products and it's used on its own to consume. Cannabis is the same. So the risks align with it perfectly.
Okay. Is it really a narcotic, or was it lumped in during the Nixon administration?
Well, it's Schedule 1, which is, as you know, no medical use and potential for abuse, as we talked about. So I think that ultimately that question it sort of has to be asked in every situation, because if you're going to ask the US government right now, yeah, it's a narcotic. It's considered, a Schedule 1 drug. If you ask a patient that has been getting tremendous relief and has gotten themselves off opioids because of it, or is getting through their cancer therapy so much easier and not losing weight because of it, they're not going to tell you that. They're going to tell you that it's not a narcotic, that it's a life-saving plant medicine. And I think there's a lot of room in between. So it really depends who you talk to. But I think it would be my guess, and I try to not make assumptions and stuff too much, but I don't think it can be considered a narcotic for too much longer. There's just too much other data and uses involved, and that will have to be addressed not only in the US, but globally through the United Nations and their scheduling.
Okay. Do you know if any hemp or marijuana is ever consumed raw?
Yes, for sure. It is both. So lots of people juice with the fresh leaves of the marijuana plants. You get all the terpenes and cannabinoids and all the vitamins and minerals, but it doesn't get you high. You just use the leaves that are discarded, when we take the flowers to make into buds and stuff. But hemp too. People have, they smoke just basic hemp now. I wasn't even aware of that until a year ago when I was over in Switzerland, and everybody, they sell it like tobacco in a pouch, to roll your own. And people certainly juice that as well. So it definitely is taken on its own.
Okay. This is kind of a comment question. You began promoting the cannabis plant uses over broad categories, both psychotropic and other. Are you saying that products for psychotropic uses are safe? If so, at what levels of THC are safest?
I am, and I want to be very, very clear, I am not saying that any cannabis is safe. I don't even feel qualified to make that opinion. I know what I know, and I intimately know this industry. I think I will say the psychotropic effects of cannabis are what's scary to people, right? And that's why we see it regulated so much, and that's why we see all the security requirements and all of that kind of stuff. But I'm not sure that means it needs different regulatory requirements. And I'm not sure that it means that it's safe because it has that or doesn't have that. I think long-term safety data is definitely something we need. We know people are getting a lot of relief and improvement from cannabis, but what we don't know is what that's going to look like in 100 years when we've got long-term societal data and how it interacts with hospital visits and everything else.
Okay. So another question is, any cannabis products with THC greater than 0.3% is not legal in the US, ? Even though some states have legalized THC containing cannabis products. So I think the question is about the conflict between
federal and state.
Federal and state.
Yep, exactly. And that's the problem, right? So federal law, and we talked about the Food, Drug, and Cosmetic Act and what is it, Section 302 or Chapter 2 or something, 301 Chapter 2. Those laws are federal laws, and from a federal perspective, if it's got more than the 3.3% of the THC, it is still federally illegal. Now, then you have, every state except 8 that have put some sort of legalization around cannabis, and that has nothing to do with the THC levels for the most part. I mean, it literally, THCs can be levels up to, 35% or whatever, and most states don't even regulate that part of it. Some of them are starting to, but that's the difference in the federal and state law. And I think the important part of that is the way the industry sits from a state regulatory perspective right now is the products can't cross state lines. And so if you look at it from owning a business, if you own a Fridays restaurant, you want to open a new one in another state, what do? You take your team that works well together at your existing restaurant and you go and have them open the new one and train people. You can't really do that in this space a lot because the laws are different and they're drastically different. Not only in their requirements, but in their language and what they call things and everything. So it's really, really difficult for that. And I think that, again, that is part of the reason why we see a challenge with making consistent products. So if a brand might be in 11 states, but not any of the products that brand makes are made in the same facility, right? They're different from state to state. So it really does create a problem.
Okay, we had a question about whether you've seen a trend in dosings.
I'm not really sure what that means. So here's my take on dosing, and hopefully this will answer. And again, anybody's welcome to reach out later if they want to talk or email or whatever. I'm happy to chat always. But dosing, to me, like people ask me when we set up the standards in 2014, why didn't you create a dosing standard? And to me, there's no point in creating a dosing standard or dosing guidelines if you can't make the product the same from time to time. So 10 milligrams in one product, maybe 100 milligrams in another product, and there's no interbatch consistency. Products are not mixed well. So there's lots of issues around dosing. Now, if you're talking about trends from like what's happening in the marketplace, there was a big push by the Colorado industry to say 10 milligrams is a starting dose, especially like for edibles, because so many people tend to take too much too early on. And so the whole go slow, start low type of, pharmaceutical mantra is very much a place. I truly believe that is the key to being able to use marijuana successfully, whether it's for, relaxation purposes or medical purposes, that, anybody that comes in and uses too much up front is going to have a bad effect. And just like if you took a new pharmaceutical and you just had terrible side effects for a few days, you'd be less apt to try it. So I think dosing is critically important. I'm just not sure we're at a place where we can create a dosing system that anybody can actually meet.
Okay. Leslie, you have been awesome. I appreciate your answering all the questions. If we missed any questions, we'll figure out a way to reach out. For those of you that are on the webinar, the recording of the webinar will be posted within 48 hours. And we appreciate any feedback that you'll share with us. And of course, Leslie has opened the door for conversation as well. So Leslie, what's the best way for people to get a hold of you?
Yeah, I should have put that up there. I apologize.
That's okay.
Yeah, so you can email me at info@focusstandards.org, or the phone number is 866-359-3557. or you can just go to our website, which is on the screen, and there's a bunch of contact forms, and you can choose any one and just send a message through like that. And we'll get back to you. And we're happy to, answer any calls. I'm always looking for feedback. So I appreciate you asking for that, Brooke, because as one of the co-chairs of the Cannabis Committee, we're trying to figure out what we can create next year that will be helpful for industry and regulatory. And so the more information that I hear and get, the more effective we can be to sort of move things forward.
That's awesome. Well, as always, talking with you and listening to you is always fascinating. And again, I appreciate your taking the time to share this with our AFDO professional development attendees. So with that, thank you very much for attending, everyone. And Leslie, thank you to you. And we look forward to seeing you on our next webinar.
Thanks so much. Have a good day, everybody.
Thank you.